Today, we're going to talk about a disease that's often called the forgotten pandemic. Now, here's the crazy part. It's preventable and it's treatable. And yet, it's still one of the world's absolute deadliest infectious diseases, especially for kids. So let's get into why that is. All right, let me just start by asking you a question. When you think about the biggest infectious killers of children on the planet, what are the first diseases that pop into your head? There are a few that get a lot of media attention, but the real answer, well, it might actually surprise you. It's pneumonia. And the scale of this is it's staggering. In 2018 alone, just 1 year, pneumonia was responsible for the deaths of nearly 1 million children. Think about that. 1 million lives. Gone. All from a disease we pretty much know how to fight. This number right here is exactly why we have to stop forgetting about it. So for our first section, let's really try to frame this problem. Why do we call pneumonia, which is a type of acute respiratory infection, or ARI, why do we call it a forgotten pandemic? Well, it's pretty simple, really. While we've been focused on other huge health crises, this silent killer has just kept on doing its devastating work in the background. And to put that million number into perspective, pneumonia is responsible for about 15% of all child deaths around the world. So this isn't some minor issue. It is a massive piece of the pie. The burden, as you might guess, falls hardest on developing nations, especially in South Asia and sub-Saharan Africa. That's where things like malnutrition and poor access to healthcare basically create a perfect breeding ground for this disease. And look, this is not some far-off problem. Let's bring it closer to home with some data from India. Acute respiratory infections are the cause of about 13% of all deaths in pediatric hospital wards. And in just 1 year, 2022, pneumonia took over 2,500 lives. These are not just numbers on a chart. This is a real, persistent crisis happening right now. Okay, so we get it. The problem is huge. But what exactly is pneumonia? How does a simple cold, something we all get, turn into a life-threatening infection? Let's break down the basics. Okay, so at its most basic level, an acute respiratory infection, or ARI, is just an infection somewhere along the path that air takes when you breathe. So that could be anywhere from the tip of your nose all the way down into the deepest part of your lungs, these tiny little air sacs called the alveoli. But here's the really crucial difference. We basically split these infections into 2 types. You've got your upper infections, think the common cold or a sinus infection. They're annoying, for sure, but they're usually milder. But then you have lower infections, and these are way more serious because they reach down into the lungs. This is the category where you find bronchitis and, the big one, pneumonia. So what actually causes pneumonia? Well, it's not as simple as just catching a bug. It's more like a recipe. It's a perfect storm that's created when 3 key ingredients all come together at the same time. Let's look at what they are. Okay, so ingredient number 1, you need the germ. This could be a bacteria, like Streptococcus pneumoniae. That's the #1 bacterial cause. Or it could be a virus, like RSV or even measles. Ingredient 2, you need a vulnerable host. We're talking about someone whose immune system isn't at full strength, like very young kids or the elderly. And finally, ingredient 3 is the environment. Things like overcrowding, bad ventilation, or even indoor air pollution from cooking with wood fires, they create the perfect conditions for that germ to spread and really take hold. And that vulnerability I mentioned, it is never more intense than in the first couple years of life. It is absolutely staggering. But 80% of all childhood deaths from pneumonia happen before a child's 2nd birthday. This is exactly why it is so critical for parents and caregivers to know the warning signs. Which, of course, brings us to maybe the most practical and important part of this whole explainer. What do you actually look for? The good news is, these are simple, observable signs. You don't need any fancy medical equipment, you just need to pay close attention. And knowing these signs can literally save a life. So, the first big warning sign is fast breathing. But here's the trick. What's considered fast really depends on how old the child is. So for a tiny infant, under 2 months, anything over 60 breaths a minute is a red flag. For a child between 2 months and 1 year, that number is 50. And then for a toddler, between 1 and 5 years, it's over 40 breaths a minute. And you can check this yourself. Just quietly count their breaths for 1 full minute. Okay, the second major sign you can literally see is something called chest indrawing. This is a super clear visual cue. Instead of their chest expanding out normally when they breathe in, you'll see the lower part of their chest wall actually sink inward. It's a clear sign that their body's working way harder than it should just to get air into their lung. All right. Now, on top of fast breathing and chest indrawing, there are some absolute danger signs. And if you see any of these, you have to get medical help immediately. I'm talking about the child being unable to drink or breastfeed, having convulsions or seizures, being incredibly sleepy or hard to wake up, or if they just keep vomiting. Any of those mean the infection is very, very severe. So, look, we know what causes it, and we know what the warning signs are. And the best news of all is that we have some seriously powerful tools to fight back. So this last section is all about prevention, because honestly, the best way to treat pneumonia is to stop it from ever happening at all. So the strategy has a few layers. Of course, we need to tackle those environmental things we talked about: better nutrition, better living conditions, cutting down on indoor air pollution. And we absolutely need to make sure caregivers know those warning signs we just covered. But the single most powerful, game-changing tool in our arsenal is right there at the bottom: vaccination. And what's really interesting is that not all pneumonia vaccines are the same. For little kids, we use something called a conjugate vaccine, or PCV. You can think of it like it's specially designed to teach a child's young, developing immune system how to build a really strong and long-lasting defense. For older adults, though, whose immune systems are already mature, we often use a different type, called a polysaccharide vaccine, or PPV. And get this. It's not just about the specific pneumonia vaccine. Other routine shots are also absolutely critical in this fight. The measles vaccine is a huge one, because severe pneumonia is one of the most common and deadly complications of getting measles. And the pentavalent vaccine protects against something called Hib, which is the second most common bacterial cause of pneumonia. It just goes to show you how everything in public health is connected. And that leaves us with one final, really big question to think about. If we have the tools, if we have the knowledge, if this disease is both preventable and treatable, then why does pneumonia still kill a child somewhere in the world roughly every 30 seconds? The answer, you see, isn't just a medical one. It's tangled up in poverty, in access to healthcare, in education, and in global awareness. And that's a question that forces us to look beyond the science and really look at the world we've built. And that's a challenge for all of us.